So my name is Prem Randhawa. I'm a consultant ENT surgeon. I subspecialize in the field of rhinology and facial plastic surgery, which effectively entails any sort of pathology of the nose and sinuses, and include things like treating things from hay fever, blocked noses, nasal polyps, sinus disease, as well as performing nasal reconstruction, as well as cosmetic surgical procedures on the nose and face. It's been a lifelong dream of mine to be a doctor, and I can't pinpoint the exact reasons, although I was always very interested in how the human body worked when I was growing up. And during my studies as a younger boy, um, uh, I always used to read things about science and experiments, and used to carry out my own little experiments. And it sort of further enhanced my interest to wanting to become a doctor, and more so a surgeon. Um, I think I quite like helping people and treating people. It gives me great satisfaction, and even till today, and I have absolutely no regrets in terms of my career choice. So when I first started medical school, having rotated through lots of specialities, um, I came across quite an inspirational figure who was very encouraging, and he was an ENT surgeon. He guided me, he helped me look at the bigger picture, he helped me write a few publications, and in effect, he was I guess, a mentor. And I looked at him and I thought, and I looked at the work he did, and I thought, this is what I'd quite like to do. And so I tailored my surgical career accordingly. And as I sort of progressed in that field, I knew that this was exactly what I wanted to do. And then I moved on to subspecialize into the field of noses and sinuses, because that's a well, the specialist area which I enjoyed the most, for a whole variety of reasons. You know, dealing with nose and sinus issues, having um, hay fever myself, sort of made me sort of want to be able to treat that a bit better. And then I quite like the art form that was involved in the facial plastic side of things, with doing rhinoplasty, facial surgery, and hence my venture down into that sort of subspeciality route. I think I find my job very rewarding, and I think I'm quite lucky from that perspective, that I quite look forward to waking up and going into work, and I enjoy every aspect of it, from seeing new patients in the outpatients, trying to make a diagnosis and help patients, to seeing all my follow-up patients who I have treated, and have very good and happy with their medical as well as surgical outcome, and that gives me sort of good satisfaction. I also like the challenge of doing the complex surgical work that I do, which either includes nasal reconstruction, or or even treating patients with facial paralysis and reanimating their faces, as well as being involved in some craniofacial surgery. So all those sort of complex things, as well as the sort of bread and butter, as we'd like to call it, does give me a challenge, and makes me enjoy my job, because there's a nice big variety in there. And I think I'm very lucky to be in the position I am in. I think my patients value the most about me is my honesty. I think I'm honest in terms of what sometimes can and can't be achieved from any sort of particularly surgical sort of outcome. I also strive and do my best to try and help treat the medical problems they have, and I'm also very approachable and friendly. I think patients find it very easy to talk to me, and I find it quite rewarding to sometimes just sit and talk to patients, even about things that are not related to the pathology they've come to see me about. So I think that sort of rapport which I build up with patients, they appreciate the most about me, amongst, as I say, my expertise in the field I'm in. And I think that's a very important aspect of being a good doctor and a clinician, is being able to listen to patients, address their sort of concerns, and then act on it appropriately. So I don't really have a catchphrase or I guess a mantra, but I treat every patient as individuals. I listen to what they have to say, and I try and address their problems to the best of my ability. I also always involve patients in decision making on their care, especially when there are a variety of options available in terms of treatment, which I think it's important. And I think the key for me is, is listening to what patients have to say, because I think you can get a lot from actually listening to what patients have to tell you about their medical problems.